excited to introduce you to our audience. So let me tell them a little bit about you, and then we're going to dive right in. So Dr. Anna Ojeda joined Jackson Health System, the Department of Psychology, in September of 2023, and she comes with a wealth of knowledge and experience, both in outpatient and inpatient child and adolescent psychiatric settings. So she received her bachelor's and master's from the
For
U.
you,
And she graduated from Regent University in 2008. Remind me where Regent is.
Virginia Beach.
Virginia Beach. Oh, awesome. Okay, so you've been kind of all over. She got her doctorate of clinical psychology there, and then she completed her clinical internship at Jackson Memorial University of Miami School of Medicine and her postdoctoral fellowship at Nicholas Children's Hospital. So, man, what a great range of experience that you've
Mhm.
had. She became board certified in clinical psychology by the American Board of Professional Psychology in 2018. And she's also had a strong role in the community. This is so cool. As a co-founder, executive director, and supervising psychologist for Urban Promise Miami, which is a program pioneered in Camden, New Jersey, focused on empowering neighborhood youth to reach their potential. I love that. Despite the odds against them, you're providing these amazing
Yeah.
resources to help them reach their potential. I think that is so awesome. And as of 2020, I hear Urban Promise merged with Hope for Miami, a similar nonprofit where you continue to volunteer.
Yes, yes,
That's
yes. Lots
amazing.
of lots of cool things about that journey and that phase of my life. Yes.
That's awesome. That's always my favorite thing to hear when I have an expert who not only uses their knowledge to serve their patients, but to serve beyond that. And that's just so
Mhm.
cool. So thanks for doing that. Dr. Ojeda, welcome. We're so glad you're here.
Thank you, Sarah. It's such an honor to be here, and I love to see that we have so many participants and that we have people from all over.
Isn't that amazing? I'm so
Vero
excited.
Beach, Venezuela, even.
Love it.
That's wonderful. Ecuador, I saw lots of cool places.
Amazing. Okay, and someone asked if we're going to share this recording. We are. Give us about a week just to get it all up on the site, but you should get an email if you joined, via email, but also parentalguidance.org. There is an archive full of dozens. I want to say 30, 40, 50, 60 episodes there.
Mhm.
So go check that out. But today we are talking about social development. So we talk a lot, I feel like we all kind of have enough knowledge to be dangerous when it comes to physical development, maybe even mental development, but social development is really something we don't always talk about or think
Mhm.
about when we're relating to children, especially our own. And so just start out with telling us, what is social emotional development?
Thank you again, Sierra. So I will answer questions in the context of my experience as a psychologist in a hospital setting, also my experience as a psychologist in a community setting. And so I will try to integrate just basic knowledge about social development and also knowledge that's connected more specifically to social development and mental health. Even severity of mental health, being an inpatient psychologist at this moment.
Awesome.
Is that
That's,
fair?
that sounds great. Yeah.
Great. Okay, sounds good. So social development, so there's various domains of development, right? We have the cognitive development, we have language development, um, physical development, and social emotional development is one of my favorite, probably because I'm a psychologist and I tell my kids that I work with that I am the feeling talking doctor.
I love
Because
it.
yeah, because if you say, "Hi, I'm Doctor," they always call me Dr. O. That's my name
Oh,
here
that's
at the hospital. It's always been. But when you say doctor, it really scares kids. So I tell them, "Don't worry, I'm the feeling talking doctor. I don't poke or do anything like that."
not coming with a needle. Yeah.
Yeah, so they get really excited about that or happy or relieved, I should say.
Yeah.
So social emotional development for me is one of the domains of development that are really interesting and really sort of cool because we as parents, and I'm a parent also of a little beautiful little boy who's 7 months old. And I have mentored many adolescents. I have a lot of experience, worked with adolescents for many, many years. So we will talk about social development in the context of young children all the way through adolescence, like Sierra mentioned. And I have now my own personal experience with my little baby, but also lots of clinical experience with some older folks, older kids. So social emotional development is gradual integrative process through which children acquire the capacity to understand, experience, and express and manage emotion. And that all equals having meaningful and positive relationships in their lives, right? So that is why it's my favorite domain of development, even though they're all equally important. I can't say one is more or less important than another. So as we go through this presentation, we'll talk about the two most important aspects, I guess, of social emotional development, which is both the development of the self and then the development of relationship and attachment to others. So those are like the two areas of social development that we'll expand on a little bit as we take your questions through the webinar.
I love it. Okay, talk to us about and you alluded to this a little bit, but what does social emotional development encompass, as we're like thinking about this topic as a whole?
Right. So let's talk a little bit about the development. Actually, let's talk about what we call the biopsychosocial theory, right? So how do we understand people? How do we understand how do psychologists conceptualize? That's a big word, but basically it means how do we understand the development of human beings, right? And we tend to do that. So there's various theories, multiple theories of how we can do that. But one of my favorites is the biopsychosocial theory, right? Which is incorporating biologically what are we born with, right? Like our temperament, which we're going to talk about.
Yeah,
And
I didn't know that.
I know. And then our psychosocial environment, right? So what experiences have we had in terms of developing relationship and developing our feelings and our emotions? And then socially, what are we exposed to? So of course, we for some of our children that have parents that can be home with them, or parents that have more connection or time with them, that's kind of easier. And then we have lots of families that have to work, like myself, have to work, have to be out. And so then how do we, what type of social exposure do those kids have? Do they have it through a nanny? Do they have it through their school, their daycare? So kind of bringing in all of those variables together to better understand where our kids are developmentally and where they're headed developmentally. So that's the self. And in connection to relationship, we also want to talk about attachment. And so we'll talk about attachment a lot. And so I actually, in conversation with the team before we went live, I was saying, I love talking about social emotional development because I can really empower parents and say, you guys have so much control of how to help your child develop a very strong social emotional aspect of their self. And so that's what I'm here to do, is to answer questions and help empower all of you to do that by building ourselves up as parents in various ways that we'll get into.
Yeah. Oh, that's so important. And I just round of applause for everyone who took a moment of their day to be here to be equipped. So that's what we're going to do. We are going to get equipped. Now, you said we're going to talk about temperament. I'm ready. I have 4 little people, and it blows my mind that they could be so different. I'm like, you all came from the same place, but you're all so different. So talk to us about temperament and, the influences of that and the different types of temperament. How about that?
Sure. So, that's funny because, Sierra, a lot of parents will come in to see me and tell me that, right? Like, I don't understand why my child that's the identified patient, like we call it, right? That's the one in therapy. I don't know why they're having such a hard time, because my other children are fine. Right. They're not struggling. They express their feelings just fine. They're social at school. They're not shy. They don't struggle. And so then I start talking about temperament when they ask those questions, and I go, all of our kids are really, really different. We're also going to talk about resilience as it relates to our kids and as it relates to parents, which is another factor there that influences differences within our kids. But in terms of temperament is an innate attribute that defines our children's approach to the world. Okay, so it's basically your child's personality since the moment that they're born. And being that I have a little baby, which now, of course, I'm dying to show everybody the picture of,
Yeah,
but
I know.
I'll contain it. I'll contain it till the
You
end.
can.
Um,
You're welcome to slip that in here
I
anytime.
will, don't worry, I'll slip it in at the end. But now that I have a baby, I've seen his personality. Actually, it's interesting because I feel like I've seen his personality since he was in utero.
Huh?
Ever since he was in my belly, I kind of felt a very calm temperament from my child, and now I really see that coming to life. He's very chill, if you will, right? He's very calm, and so that's one of the temperament types. So there's three different types of temperament.
Okay.
One of them is easy or flexible, which is how I describe my son. That means that they're very friendly, they're easygoing, they kind of comply with routines and sleep and meal times, don't give us too much of a hard
Isn't
time.
that so nice?
I know that's like the ideal child, right? And so they adapt to change and they have what we call a calm disposition, right? So they're gonna cry anyways, of course, it's very normal when they're hungry, but they're not very fussy.
Okay.
Which leads us to the second type of temperament, which is more active or feisty or fussy babies, right? And these have a harder time following routine, maybe feeding and sleeping. They're a little apprehensive about new environments and people, and they tend to have very intense emotion and they may become very easily rattled or upset.
Yep.
Okay, and we all know
Got
those
one of
kids.
those too. I'm
Exactly.
like,
So,
check, check.
right,
Four
if you
kids, three temperaments. So I want to see how this shakes out, you know?
exactly, if you have multiple kids, you're going to see this. And then, so the third one is what we call slow to warm up, right? Or more cautious.
Mhm.
And these kids are maybe less engaged or active. They may be shy, is typically what we've seen, or they may be more withdrawn, or have a little bit less comfortable, feel less comfortable maybe in different environments, environments that they're not as familiar with. I think what's really important that we take from this is that none of these are good or bad.
That's right.
Okay. I think it's really important to not label them per se. I think it's important to just look at them for what they are
Mhm.
and think about, as a parent, how do I have to adapt or adjust my parenting style to my child's temperament,
That's
to their
good.
natural predisposition.
That's good.
Now, for example, my child naturally, right, intrinsically, has a very calm disposition. However, if my child were to live in a very anxious setting, and this is where the psychosocial component comes in, that is going to obviously impact their temperament. That's going
Yeah,
to shift it maybe, maybe not if they have a lot of resilience, which like I said, we'll get into, but it may. So environment is very important, but we have to consider what it is innate to our children.
that's good. I would assume our temperament plays into that as well, into our parenting style.
Absolutely. That's a
When
great point, Sierra. That's a
yeah,
great point.
we
And
have
that's,
one as well.
yes, and that comes into the attachment conversation, right? Our temperament and their temperament. Are we a good match? And sometimes we're not a good match with our kids. I mean, even
Yeah.
though they're our children, sometimes we're not a great match.
Yeah, I heard something recently that said, really our children are one of the very only relationships that we'll ever have that we didn't hand select. We didn't get to choose,
Right.
I want this kind of kid and this way. And so
Mhm.
that it's just a divine opportunity for us to be shaped and challenged and for us to,
Exactly.
learn. So not just how can we help this kid, but that we're being shaped even in that. So I love that. Talk to us a little bit about let's see. So I got a question from our audience, but before I
Mhm.
get to that, we're talking about temperament. So, and you said that it impacts a child's social, emotional development. Can you talk about how it does, and then also bring in the piece about attachment and why that's so important?
Mhm. Yeah, well, it's all connected with attachment, right? So, our temperament is going to, again, predispose us to how we take in information, how we understand information. But however, how our parents are communicating that information to us, how they are teaching us about emotion, right, is going to play a large role, and how those two how temperament and environment interact, right? The famous nature versus nurture, but it's really kind of a combination in reality based on the biopsychosocial theory, is key. So um, some of our kids may have a harder time managing emotion, expressing emotion if their temperament is a little more active or a little more slow to warm up, or and so, or if their environment has been more stressful. Okay. And I want to start off by saying all of our families and environments can be stressful at times. There's no black and white situation. So please do not feel guilty. Parents are experts at being guilty about everything, right?
That's the
Myself
truth.
included. We feel guilty about the way we sneeze sometimes. I mean, it's
Yeah.
terrible.
Yeah.
And so there's no judgment in this space. And I think that it's important for all of you to see parenting as we don't come with a manual. We have no idea. Even as a psychologist, I fail sometimes, and I will fail many times as a parent, because that's just the way it is. So that's okay. And we can't always control our environments. And so yes, the temperament is like the first thing that impacts social emotional development, just because innately we may not understand or express emotion naturally with as much ease as some other kids.
Yeah. To take all that great information, let's take it to a scenario. So I know
Mm-hmm,
you mentioned like the age old question of nature
mm-hmm,
versus nurture. Like, how do you know
mm-hmm.
when it's like a situational things are kind of in play versus like their temperament, what? So here's a question that we got from our audience. They
Sure.
said, my 5-year-old son was happy when he started school, but a few months ago he started a medication for his asthma, and then he started having mood swings and depression. So his pulmonologist stopped the medicine and he's off the
Good.
medicine, but he still secludes himself during PE classes and cries, saying that he misses his parents. He doesn't like to go to school anymore, but at home he's happy and active. And this parent wants to know, how can I help them? And how do you discern,
Mm-hmm.
like, okay, this is like a social emotional thing, or there's something going on at school that maybe you don't know, like, like an environmental factor that, does that make sense?
Sure.
Question, but
Absolutely.
how could
No,
we
it's a
encourage
great
that
question.
family?
It's a
Yeah.
great question. So, 5 years old, of course, a follow-up question would be, and that's okay, I don't need an answer, but a follow-up question would be, how long has this child been in school, right? If they've been in school since preschool, then they have more exposure to a school environment. If they're new to school, then that's a factor to consider, that this may be a major shift. I think we underestimate how difficult it is to start school. I don't know if we all remember like our first day of class. Even when you got to college, our first day of class was
Yeah,
we were
of
nervous.
course.
So for children, that's a big change, I guess, from home environment. And again, depending on what type of structure they had at home. If they had a lot of attention at home, and now they're not getting as much attention at school because it's a larger group. So all of those questions, keep those in mind. But to answer the question, how do I help my child? We want to become mini detectives. Okay, so it was great that you went back to the pulmonologist and made sure that it wasn't a medical side effect to the medication. So that's wonderful. And since that's now not a concern, then if that behavior continues, then you want to maybe touch base with the school and say, hey, is there anything maybe going on that could be affecting my child? Kind of keep lines of communication really open with the school. Okay. And then you want to go back to your child, especially if it's a child with good language development, very verbal child, and you want to encourage them to share as much as they can about what's going on at school, what do you like, what don't you like. With children at that age, they're in a very concrete stage of cognitive development, right? So they're really you have to ask very direct and concrete questions that will help them provide you an answer with some open-ended questions, because you never know where kids are going to go. I've learned to let kids surprise us.
Yeah.
And then lastly, really validate those feelings, right? There's no right or wrong feeling. School can be hard. Of course, you miss mommy when you're in school. I remember I missed mommy when I was in school too. And then maybe slowly bringing them back, maybe working with somebody at the school or with a therapist or psychologist to slowly integrating them back into the school if there's school avoidance. So for example, okay, today we're just gonna go to school for a little while and let me know how you feel. And there's a special teacher that you can go to if you're not so happy at school. Lots of different things that a psychologist can
Yeah.
assist in that transition and helping them.
Love that. Great advice. Great question too. Thank you from our audience. Okay, let's talk about what part the brain plays in social emotional development. Because not just temperament, right? Like
Yep,
brain plays a big role. So kind of
correct.
talk
So
to us
this
about
is another aspect of the biological components of the biopsychosocial theory, right? So there is, and this is may surprise some of you, rapid growth in social emotional areas of the brain during the first 18 months of life, right? So
okay.
most of our capacity to understand and express emotion happens really fast in our life.
Wow.
And so no pressure there, but if we miss that
Writing
milestone
that
for
down.
right, if we miss that it really, that's why it's so important. We'll talk more about this during infancy, to really do a lot of mirroring and a lot of language. We want to expose our young babies to lots of language, lots of words, because that's how they're not only learning words but also learning communication, and the tones of communication, right? So if I speak to you like this, we're in a friendly situation. If I get mad, I'm in a mad. So we're teaching them different ways to communicate. And so that rapid growth is happening inside the brain. So the nonverbal parts of the right side, nonverbal parts of the brain are on the right side of the brain mostly. And that's unfortunately where trauma is kind of stored in the brain. And it's usually stored in the brain in a way that doesn't have a lot of verbal memory, which is why sometimes if something difficult has happened to someone and you ask them what happened, they may say, I don't know, or I don't remember. Doesn't mean they really don't know or they don't remember. There's just more verbal capacity on the left side of the brain. So, or the verbal part of the of our brain region is on the left. So therapy, for example, does a lot of what we call bilateral stimulation, which is we're trying to stimulate both sides of the brain so that we can put words to really difficult memories or difficult situations. Okay.
That is fascinating. I'm going to say, I think that could be a whole topic for a future
That
one.
that can trauma can be a whole topic, and of course connected to social emotional development and how trauma can very much impact the development of our social emotional capacity. Absolutely.
That's
So
great.
that's a whole nother. And if there are any questions about that, I can definitely help. But so the amygdala, the limbic system, all the areas of the brain that receive stimulus from the environment, that produce an emotional response, are critical in the way, again, we understand and express emotion. So again, that happens early on. So we want to make sure we're mirroring our child's emotion. I love that with my baby. He smiles, I smile. That's called mirroring. And we're doing that as much as possible so that those areas of the brain are really developing,
Yeah.
growing.
Is it good to mirror? I saw this question. Is it good to mirror like some of the negative emotions too, or is it better like if my baby's like, like
Yeah.
should I, or do I like no smile, like don't be sad?
No, that's a great question. We want to mirror, we don't want to get angry, but we do want to mirror, like if you see your baby crying, most of us will say, oh no, baby, what's wrong? It's okay, mommy's here. Again, you're not necessarily crying with your baby, but
Yeah,
you're in essence validating that baby's feelings.
it's good.
As that baby grows older and has words, then you're validating not just the affect, right, which is what we see, but also what they're saying.
It's
So,
so interesting that we stop doing that. You know what I mean? Like with our
mhm,
babies, we're like, oh, sweetheart, what's the
mhm,
matter? And then
right.
somewhere down the line, it's like, stop crying. What's the problem? You know? And then
Uh-huh.
we kind of miss that whole like validating their emotion. Oh, this
And,
is like
and
a light bulb for me.
and Sierra, and that's where we, as psychologists here in a hospital setting, that's where we see a lot of the problem
Yeah.
is in that fracture of
Yeah.
attachment. Okay.
Yeah. Yeah.
And so mirroring is a critical and important part of attachment, of building a strong attachment with your baby or your child. And we cannot fracture that. That has to continue. And if you have to pretend they're little babies in your head, that's okay. Do that. Of course, don't treat them like a baby when they're a teenager, but you're still going to think about what I did when my child was a baby. Let's keep doing it, but maybe now shifting a bit to their age.
Helping them feel safe instead of,
Correct.
I know my temptation, just confession here, is I don't know what it is, but it's so good to talk about developmental milestones and what's developmentally appropriate, because it's so easy to expect so much more of a child because maybe they're bigger or they're the second child and you expect them to act like the oldest child, and then but they're not
Right.
developmentally there, and then it's like, what's your problem? Quit crying. Come on, let's go. Instead of stop taking the time, helping
Yes.
them feel safe, helping them feel validated. Like that is so good. That's like a golden nugget there.
Really important. Yes.
Okay, here's another question from the audience. We talked about, the importance of exposure for social emotional development, but does it matter who that exposure is from or just that they get it? So this parent asks, I have a 3-year-old only child. He goes to school half day since he's 2, so for a year. Is
Mm-hmm.
that enough social exposure, or do I need to register him in other activities? Does he need after school enrichment? Does he need play dates? Is there an ideal
Yeah.
model?
So this will be a maybe popular response or maybe not. I'm not sure, but I think sometimes as parents, we put so much pressure on ourselves to overdo it with our kids in terms of enrolling them in all of these different things because they have to have all this exposure. I don't know if there's any, so much research that supports multiple areas of exposure. I think it's quality versus quantity, I want to say.
Okay.
Um, and so if they are in a school that's really targeting their social emotional development, which is something I would look into as a parent,
Ah,
how are my children, how is my child's social emotional development being fostered in school or developed in school? If
that's
it were
great.
my choice, we would do a lot more teaching in school about our feelings.
Yeah.
So we have plenty of time to learn about math and this and that.
Yeah.
So typically in preschool and lower grades, there is some more social development components to the educational plan. And that's great, right?
Yeah.
Communication, lots of different models that they're now teaching in the schools early on. And that's perfect. I want more of it, but so like that's at least something.
Yeah.
If they have a pretty healthy school environment and you also spend some good quality time, even though not a lot of time, because I'm a working mom myself. I work full time at a hospital and my son is with his nanny most of the day and some of my family. And then I spend a little bit of time, but I make sure it's quality time.
Yeah.
So when I'm with my son in the evenings, phone is off and I am in comfortable clothing and I am in my happy special place with him.
That's so good.
And I have not enrolled him in any music class or anything extra because I play music for my baby and I do those things. So don't put pressure on any of that. There's no research to really support so much of
That's
adding
great.
so many things. Yeah.
Quality over quantity. I love that. And as a previous school director myself, I say those are great questions to ask when you're touring a preschool or a kindergarten or whatever. The school should welcome those sorts of questions. Those
Of
are
course.
great things to ask. Okay, here's another one. Here's another kind of scenario. So we have a mama who has a son who is a pandemic baby. Several of us have those.
Yep.
Which threw us all for a loop. But he was
Yeah.
also born premature, so 25 weeker. So they were advised to keep him, in a bubble for 2 years,
Mm-hmm.
which they
Mm-hmm.
did for the most part. But he's now approaching 3, and they're noticing that when he does go to school, their friends have kids from his age to 6 years old. She often finds that her son is playing alone at social gatherings. So is that developmentally appropriate? Like, is he just parallel playing because there's like,
Mm-hmm.
delays with prematurity there, or is it something that they can do to help with that? He's playing
Mm-hmm.
alone while other kids are playing nearby, and he seems to just choose not to engage with them and rather do his own thing. Is
Sure.
that,
Do we have an age for this child again?
yeah, he's almost 3, almost 3.
Almost 3. Okay. So, I think it's a great question. I think the pandemic time, maybe the isolation definitely has impacted his natural tendency to gravitate towards himself, right? Because he probably did a lot of independent play, which, by the way, is not a bad thing. It's a great thing. He's going to be a great leader one day, very independent, confident, probably. So that's not a terrible thing. I think we tend to see if we're more solitary, it's bad. If we're more social, it's good. I think we need to look at that on a continuum. And we also need to look at that in the context of other things, right? So if the child seems very adapted in other areas of his life and there's no evidence of anxiety, which in a little 3-year-old could seem like more tantrums, more irritability, difficulty with routine, all of those things can be signs of anxiety in young children. If there's none of that and he's playing alone, less concerning. If there's some of that and also playing alone, maybe it could be some anxiety that we're looking at even early on, and that's where I would maybe look for some support. If there's no concern outside of him playing alone, then yeah, just expose him now that COVID is. I hope, even though we're a little bit in a bad time right now, but hopefully it's less of an issue for your son. Just maybe expose him more to more social situations now, but not too concerning. If you do see other areas of concern, then maybe this is just another reflection or manifestation of something going on internally for your son. Does that make sense, Sarah? I don't know if that was
Oh,
clear
that's a
enough.
great answer. Great answer. I
Yeah,
love these scenario questions because it's like
yeah,
then it gets
scenarios
my
are
brain
great.
going of like all my scenarios. I'm like, okay, I have
Yeah.
another question. Okay, here's another one, another scenario. My 6-year-old is very shy. It's difficult for him to talk with kids when he doesn't know them. He plays in a playground with new kids. They're soon going to be moving to another city that's 100% English, and he doesn't speak English very well. So this parent is worried about the change. How can they support him in the change?
Yeah, great question. And change is always so hard. It's hard for adults, so imagine how hard it is for kids.
Yeah.
Best advice, if he's naturally shy, going back to temperament, right? That's his temperament, is to be more withdrawn and shy. That's okay. Believe it or not, I was a really shy child, and look at me now on a
Woo!
webinar,
You're doing it.
talking to a lot of people. So that's okay. We develop, we change. But if that's naturally his temperament, again, similar to my response for the last question, if that's naturally his temperament, we have to accept it and um, allow opportunity for him to have different experiences, but not force experiences onto him, okay? Because we could cause some harm doing that, right?
Yeah.
Um, in terms of the change, that is going to be a tough change, and it's probably a good idea to really prep prep him, talk a lot to him about what the change is going to look like. Maybe ask him if he has any questions about the change, any concerns and fears about the change. I think it's hard for kids to talk about their fears. Kids believe in magical thinking, and so they think that if they talk about their fears are going to come true. And so you can make them feel pretty safe that it's okay to talk about fears with me.
Yeah.
It doesn't mean it's going to happen, but we can talk about all kinds of scenarios and things.
Yeah. It's great. Good advice. All right, next two-part question.
Mhm.
You spoke about, maybe some things could be anxiety because of like the atmosphere, the home, whatnot.
Mhm.
Um, how do we know, or what are some strategies maybe to like help reduce anxiety in the home or anxiety inducing atmospheres, if that makes sense for a child? But then
Sure.
also, like, what are some strategies to just develop social skills, in like maybe a normal functioning environment? But then maybe if there's a parent listening going, oh yeah, my kid has a lot of tantrums, like maybe our environment's stressful. Maybe I'm creating a stressful environment. I don't even know it. So kind of speak to
Right.
those two.
Yeah, sometimes we don't know. We don't know we're creating a
We've all
anxiety,
lived in
anxious.
such stress the
Yeah.
last few years
Yeah.
that I think some of us don't even realize it takes some time to come out of that.
Yeah, yeah. So, yeah, our children are like sponges, right? They're taking it all in, and this is how we help them develop social emotional development, because we're exposing them to all kinds of things. I am not, I believe that children need to naturally be exposed to natural things. I don't think that, especially as they get a little older, it's okay to, you know, banter back and forth with your husband. And that's normal behavior, right? Normal, like, oh, why'd you put that in the fridge? You should have put it here. Oh my God, that's okay. What we wanted, because that's good for them to learn how to have a healthy banter or healthy argument even.
Right.
However, we want to stay away from fighting in front of our children. We want to stay away from maybe exposing our children to lots of the news, for example. It makes everybody anxious. How many of us put the news on and we immediately feel tense or immediately feel anxious? And so while our children are awake in our home, I think it's really important to have a very natural environment, just go with the flow. However, if you are going to have a more serious disagreement, maybe have that privately,
Yeah.
because our children, again, are sponges. They're going to take all of that in. And unfortunately, because of their egocentric state of cognitive development, right?
Right.
They're only thinking about themselves when they're little.
Right.
They're not thinking about other people too much. So what they do with that though is that they internalize a lot of things. So if mommy and daddy are fighting, it must
That
be
I
my
do
fault.
kind of thing. Yeah.
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 Because they have a really hard time kind of seeing outside of their little world.
Yeah.
So it's just them. That's why when they say, I want that, I want it and I want it now because I
Now.
want it. Right. Yeah. And so
Right.
our children don't really start to develop a lot of empathy and all of that until they get a little older, like school age.
Yeah.
Piaget talks about moral development, right? And
Yep.
that empathic development doesn't happen until more of a school age time.
That's good. What, maybe if you had 2 or 3 tips that you would just give someone, and I know it kind of varies again across the
Mhm.
development and the lifespan, but just strategies for developing social skills, maybe like, infant, toddler, and then older entering school and school age. Like here are 2 little, have a feelings chart, or I don't know. What are some
Sure.
tactics there?
Sure, absolutely. So when they're tiny, tiny, we're gonna do a lot, like we said, we're gonna do a lot of mirroring. We're gonna do a lot of helping them understand different types of emotions. And so it's funny with my son, we'll have really fun laughs. Ah, and then we'll do this, we'll get kind and all of that is teaching them interaction at that level, right? So they don't really know how to socialize, but they socialize through emotion, right? So whereas an older kid learns to say, I need this, they only know how to do that by expressing emotion.
That's good.
That's how they communicate with us early on, right? Um, so there's 3 emotions actually, this is interesting, that are present from birth, and that's anger, joy, and fear. And there's no need for any cognitive input on that. It's just a natural, like instinctive emotion. And we only communicate that emotion through facial expressions, okay? And
Wow.
so right there, you're teaching social skills, okay? Right there, because one of the things we see with children that struggle socially later in their growth are kids that do not have social cues for emotion, right? So they are dismissive of other people's emotion, or they miss the fact that the conversation's over. And then those kids are the ones that struggle socially and get maybe bullied sometimes
Yeah.
as a result of that. So that starts really, really, really early. Okay.
Yeah.
And then, of course, as they start to become more verbal beings, then you start teaching social skills language that goes with the emotion, right?
Right.
And of course, when they have more cognitive capacity and they really understand more of interactions and how our communication impacts other people, that's a more advanced social development piece, right?
Mhm.
That becomes a little more complicated, like in adolescence. Then social skills development is really about communication and looking at, when I said this, it impacted the person in this way.
Yeah.
Okay, so that becomes a little more complex as they get a little older.
Yeah.
Early on, very simple, basic.
Okay, that's good. Man, I feel like we need like 3 webinars on this topic. There's so much here. All
Yeah.
right, I've got lots of audience questions, so I'm going to keep them rapid fire at you. Here's
Okay.
another scenario. This person has 2 early teens, and
Mhm.
they've noticed a significant change in personality in one of them, that he's become more isolated, socially withdrawn, distant from the rest of the family. What kind of those flags, or what are those?
Mhm.
That's the question.
Yeah, those are great. Those are great questions. So, you know your child best. You are the expert in your child. You know your child from the moment they were born till now. You know how they interact. You know what's normal. I hate the word normal, but what's typical for them and what's maybe out of their typical range. And so, if you see behavior that's new and sudden onset, you want to um, ask about it, right? You want to let your child know that you noticed it. You have no idea. Of course, I work in a very severe, with a severe mental health population here at the hospital in the inpatient unit.
Yeah.
So by the time they get to me, there's very serious concerns, right? But at a less of a serious, a lot of our kids will say, my mom or my dad
Hmm.
didn't notice that I was struggling. And that's a very hurtful place
Yeah.
for them.
Yeah.
And then they start doubting, how am I not communicating clearly? A lot of our kids don't have the words. They don't have, especially if there's been any fracture in their social development, social emotional development, they don't have a lot of words for their emotions, right?
Yeah.
And so asking the question, how are you doing? I'm noticing that you're not yourself recently. You're isolating more. Is there anything going on? Is there anything I can do to help?
Yeah.
That may be so
Yeah.
helpful and
Right.
validating.
Yeah. That's great. Just feeling seen, known, and loved.
Yep,
That's
that's,
3 words I try to keep in front of myself with my kids, and they're even little, but like, how can I help them feel seen, known, and loved? Because that
I
just
love that. I
make
love
me
that.
feel so good, Not that that's the end all be all cure all, to certainly see professionals, but I think that's a good starting point. So thank you
Yeah,
for
I love that. Seen, known, and loved. I'm gonna steal that.
Go for it. I think I stole it from someone, so just keep passing it on. Here's another one. This listener has a 12-year-old daughter in 6th grade. She's shy and has, I think, maybe a speech issue due to pronunciation of words. And it says that, I guess the parent feels that this interferes with her social interactions. She's declining academically. And when the parent asks her a direct question, she usually gets a response saying, "Everything's fine. I don't need help." Like, how can you support a child
Hmm.
like
Sure. So I always tell parents, if you think your child needs help, you make that decision. Don't let that decision be your child's decision. They're children.
that?
They need us to take the wheel sometimes.
Good.
So if you feel that, just take them in to see a doctor, make it safe for them. Be like, look, this is just a doctor to talk about our feelings. I want to talk about my feelings also because it's hard being a mom, because I sometimes don't know how to help you and I need help. So sometimes I tell parents, tell them that you need the help and they're just going with you to support you. That's a
Yeah.
great way to get your child in the door to
That's
get
good.
some help.
Yeah.
But yeah, I think again, back to social emotional development, for especially for a 12-year-old, their social emotional development in school and their social connection is so much more important than their grades at that age.
Mm.
And so if she's feeling insecure about the speech impediment and she's having maybe some bullying is happening as a result, I don't know how serious it is, and there's some social issues, it's definitely may impact her grades, and you will see an academic decline. It is possible that whatever's going on in school is impacting her emotional state. So she may be feeling a little sad, a little depressed. And so we want to take her in and just kind of see what's going on if she's not responding to you or giving you a lot of information.
Yeah. That's good. Good advice. Okay, I'm watching our time. We want to respect your time. So we've got about 10 minutes left. So I'm going to keep rapid firing questions. So, audience, if
Go
you have
for
a
it.
question, throw it in the queue quickly so we can get to it. Here's another one. A parent is asking, I'm wondering, what are the chances of a 3-year-old having ODD? So that's oppositional defiant disorder. Is that correct?
Yes,
Tell us
correct.
about that. And
That's it's early for me. I find that it's early to make that diagnosis. I know some providers do make that diagnosis early and you can, but it's a little early for me to do that. for oppositional defiant disorder, we want to make sure that the opposition and the defiance is happening in more than one setting. So if it's just happening at home, it's probably not ODD, right? We need to see that behavior at home, at school, and I think another setting as well. We want to see a broad um, symptom. We want to see symptoms that are broad in nature. But yes, we could. If the child has ADHD, then it's likely that they may also have a comorbid ODD. But again, 3 is young. I would probably have some more consultation around that and see if there's anything else happening.
Yeah, good advice.
Mm-hmm.
Here's another one. My 8-year-old son has been exposed to psychological abuse. He is
Mm-hmm.
presenting some anxiety and behaviors towards women. What can I do?
Mm-hmm. Yeah, anytime there's abuse or trauma, I have to say it's imperative that they receive treatment from a provider that has specialty in trauma. So please, look at, if you have insurance, look at your provider list and maybe make a few phone calls and ask your providers, do they have experience working with trauma? Psychological or emotional trauma is equally difficult for a child. It doesn't have to be physical abuse or sexual abuse. It could be emotional abuse, can be really, really damaging for a child. And so we want to make sure that they're treated as early as possible. Early prevention is critical with trauma.
That's great. That's great. Thank you. All right, here's another one. How to help a 6-year-old with his temper, not to overreact, getting frustrated, hitting peers, throwing things.
Yeah. Again, is that happening only with peers? Is that happening at home as well? So we want to see, where is this happening? What's the context? So there's lots of pieces to this. Typically, when we have a young child that has like an adjustment issue and they're acting out because of an adjustment, so something minor, we can easily put them on some sort of token economy behavioral plan, and they will be motivated to change their behavior because they're going to get something really cool, right?
Right.
Or they're going to get more time with a privilege of theirs, a reward for them. If it's more than just an adjustment, if there may be something greater happening, then you want to work with a provider to make sure that we are also treating the underlying reason for the behavior, right? So you don't want to just shift the behavior, but also understand why the behavior is happening.
That's great. All right, here's another one. What do you think about school-age children sleeping with the mom in a single-parent home?
School-age children. There's lots of research now that encourages a family bed. It's not necessarily frowned upon anymore, right? There's lots of, of course, for younger children, there's some controversy around school-age children and, all of that, but young age children, and even school-age children, it may reinforce their attachment. And it builds confidence. There's lots of new research in that area. We don't have time to get into it, but there's lots of new research in that area. So no shame in that. Of course, it becomes a problem sometimes for the mother and the father because they need their privacy. It's not comfortable.
Now
And
you're gonna get an angry mama tomorrow if I don't
you're
sleep.
gonna,
So I don't
because
know how this is taken out.
a school age child is bigger, and so they're not gonna let you sleep very comfortably.
Yeah.
But there's less concerns about, is this gonna like do something terrible emotionally to my child? Probably not. However, again, can't say this enough. You have to look at the context, right? What else is happening in that child's life, right? Is this just because he needs some extra special time with mommy or daddy? Or is this because they're scared a lot? They have a lot of fears. There's a lot of anxiety. There's some other thing going on. So again, don't ever look at anything in isolation. Nothing happens in isolation. Everything is part of a larger picture. But cozy time with your child in your bed is not a terrible thing.
Right. So many good questions. We got 5 more minutes, so let's see if we can get through the last few. There's a few, so I don't know if we're gonna get to all of them. I'm trying.
We'll do our best.
Let's do it. I'm gonna blitz, okay? My son is 12 years old, and we've been having challenges with him managing his emotion. He cries for a lot of things and says, I don't know why I'm crying. When younger, he never cried, literally never. Sometimes I feel like he missed that milestone of crying. He is seeing a psychologist, but it also seems it's not helping, and it's been a couple of years. Also, challenges in getting appointments with this, a psychologist. That's a huge challenge right now. So,
Mm-hmm. Well, it sounds like you may need another psychologist if you're not getting appointments. That's number one.
yeah,
If this child has a really good, strong relationship with the psychologist, then you don't want to pull him from the psychologist without talking to him about it and without maybe talking to the psychologist about it. So maybe say, hey, listen, my son is really struggling and we're having a really hard time getting an appointment. What can we do? I
yeah,
really want my son to continue in therapy with you. Um, if there's not a strong relationship, then maybe a different approach, a different psychologist. Sometimes even some of my patients I've recommended, hey, why don't you try a different approach? Maybe that could be helpful. It's okay. That's it's like getting a second opinion from a medical doctor. No problem. What your son is experiencing seems to be emotional dysregulation, which can be connected to so many different things. And so I don't know without interviewing you further what may be going on, but please get the right support.
yeah, that's great. All right, here's another one. My almost 3-year-old daughter has been refusing to sleep for the last 3 weeks. She's prolonging bedtime. I need more milk, more books, want to sleep with me, and then throws
Oh,
tantrums when you leave the room. Prior to this, she would sleep on her own without an issue. When we try to put her to bed, she cries. She's very defiant, will not go to bed. Of note, I'm not a psychologist, but I have an inkling here. Um,
I think
of
you can take
note,
this one.
no, no, no. She said she adds at the end, of note, she's potty training and they're expecting a new baby.
Well, there you go.
I don't know.
Yes,
My
yes,
gut
she's
says a lot of changes are happening for this sweet little
yeah.
one.
So we didn't have time to get into this, but there's like Eric Erickson, for example, talks about the different stages of social emotional development, right? And so she is in a very interesting stage of autonomy, right? And wants to be independent, but at the same time, there's this major change and she's trying to kind of regress a little bit. So it seems like there's a little bit of a regression and a little bit of a sleep regression and also maybe an emotional regression because she's so afraid of this change that's coming up. Very normal. I would go with it as much as you can. Stay awake. I know it's hard. Um, Trust me, I know it's hard. But just maybe do a lot of validating and try to keep her on the routine as much as possible.
Yeah, that's great. We are out of time and I hate it. We got 2 minutes left. And so I want to kind of wrap a bow on it, but I want to
Yeah.
encourage all of our listeners. First of all, thank you for engaging with so many amazing questions because having scenarios like that
Amazing questions.
helps us flesh it out. Yeah. But
Yes.
I would encourage you that we are going to start working on a part 2 of this because there's just so much here to unpack.
Yep.
We'll never get to everything. We can't get to all of it today. And so, but we will get to it. And so I guess I just want to kind of end, Dr. Ojeda, tell us,
Mhm.
maybe like maybe there's a parent listening going, oh my goodness, this was so eye-opening. And like now I'm thinking maybe our environment's stressful, or maybe my kid is, having an issue, or maybe how do I know where he is on milestones? I would just say, what word of encouragement would you leave with a parent? Are there social emotional specific screening tools that are important
Mhm.
that you would direct them to, or just kind of like what would be the next step until we can get episode 2 live and up and everybody
Yeah.
can come with
So
more
is there
scenarios?
any is there time for like even just 1 second of that graphic that
Yes,
we
please
had?
put it up.
Okay.
Yes, yes. Let's do the graphic. Please talk
Just
to us.
1 second of it.
I
So
love it.
like I said at the beginning, our as parents, we have so much um yeah, so we have so much control here, as you can see, right? We
Yeah,
want to make sure we're really fostering our attachment with our children, really nurturing them, which is not easy for all parents because we as parents have our own baggage and our own stuff. I
agree.
encourage you to seek your own therapy, look at your own attachment styles. Some of us are, if you see here, resilient. Some of us are resilient. We rise and thrive in difficult situations, and some of us don't that much, right? And so we want to really work on this aspect. How are we coping, right, with our stressful situations? We want to have social and community connections. We don't want to raise a child in isolation. It takes a village. Let's please make sure we do that. And then gain a lot of knowledge about Social emotional competence means understanding what we just talked about really well and having knowledge about development in general. So I know we have to stop, but that's just like a Cliff
No,
Note
this is
version.
good. I would say if you're watching, I'm on a Mac, so I can do Command Shift and then 4 will let me take a screenshot of this. So I am screenshotting this because I think that's just something good to keep in front of me. But this we'll have a recording, so we'll send that on and it'll be on parentalguidance.org so you guys can refer to it. I do want to go ahead and just share with you, mark your calendar. So we're doing these once a month. The next one is Thursday, February 15th at noon. Great participation today at noon. So we're going to continue with that. And it is going to be, the title is Preparing for Birth. So whether you're about to have your first baby or expecting your fifth, the birth process
Oh
can feel
my,
overwhelming. I mean,
you're
overwhelming.
brave,
Oh,
Sierra. You're
oh,
brave.
I'm crazy, but I'm excited. I'm happy. I'm blessed and I'm bonkers. This is what I say. But everything from creating a birth plan, navigating for labor and contractions, emergency signs, all of that, we're going to learn the ins and outs. So make plans to join us Thursday, February 15th at noon. Also, you can take a screenshot of this slide, which is just some great websites to continue your study on today's topic. And again, recordings of all the parental guidance webinars, as well as downloadable tips and resources, can be found at our website, parentalguidance.org. So you can also sign up to be notified about upcoming episodes. So thank you so much. An incredible, incredible audience today. Dr.
Thank you.
Ojeda, you are a
Wonderful.
wealth of information. We appreciate your expertise. And just thank you again. And I hope that you'll all join us February 15th and stay tuned for part 2, because we definitely are going to need a part 2 on this. So Dr. Ojeda, thank you so much.
It's my pleasure. Thank you all so much.
Have a wonderful week, guys.